Hello doctors, welcome back to our series of NEET MDS 2021 recall. In this video, we are going to see about chronic maxillary sinusitis. So what is chronic sinusitis? I think most of you have experienced sinusitis by now. Like most of us suffer from that. So what is chronic sinusitis? A chronic sinusitis is nothing but a long-lasting sinus inflammation and infection. So you all know how many sinuses we have, right? So especially near the face. So they are like in the head. So they are like around four paired cavities. The sinuses are four paired cavities in the head. So these cavities are connected by narrow channels. Okay, so these spaces are named as ethmoidal, sphenoidal, frontal, and maxillary. So the four sinuses are ethmoidal sinus, sphenoidal sinus, frontal sinus, and maxillary sinus. So how long does this chronic sinusitis linger? It typically lasts for more than 12 weeks. Okay, the sinuses make thin mucus that drain out of the channels of the nose. So this drainage works as an infiltration system, keeping the nose clean and free of bacteria. So what is a maxillary sinusitis? Maxillary sinusitis is nothing but inflammation of maxillary sinus. So in this picture you can see the sinus. So this is a frontal sinus, ethmoidal sinus, and this is the maxillary sinus. Okay, so it is a localized involvement of the maxillary sinus. So it can occur as a pain over cheek bone, toothache, periorbital pain, or temporal headache. So the pain areas for maxillary sinusitis is over cheek. Okay, it might be around the tooth as toothache, or around the eye as periorbital pain, or it may be a temporal headache. So temporal headache is also associated. So it is associated with increased pain when head is held upright and less discomfort when patient is in supine position. So when patient is lying, he feels okay, but when the patient is standing or sitting, he might feel increased pain. So the frequent complaints include facial pressure, pain, or sensation of obstruction. So the non-specific symptoms about maxillary sinusitis is like headache, sore throat, and lightheadedness or generalized fatigue. Then coming to the causes for maxillary sinusitis. So as we have seen, periapical or periodontal infection from the teeth. Okay, dental trauma, dental extractions, maxillary osteotomies, and placement of implants. So these are the causes which can inflame the maxillary sinus due to from the dental point of view. Okay, please make a note of it. So the diagnosis, so as you can see the images here, these are the various modalities by which we can diagnose the maxillary sinusitis. So it is less diagnostic and radiographic imaging is very much important. So as you can appreciate from this OPG, so here this is the maxillary sinus and the way it is inflamed, you can observe it here, right? Okay, it is filled with fluid. So this is a empty cavity, but here the cavity is filled with fluid. Okay, so this is what is sinusitis. And here from this CT image also you can see, right? It is filled with fluid. Then this is a view where we can see the maxillary sinus. So this is the normal maxillary sinus. It is just to show you how a normal maxillary sinus looks like. So this is how a normal maxillary sinus looks like. Okay. Coming to the question they have asked in NEET MDS 2021 was, this is again a clinical question. So a patient complains of fever, dull throbbing pain in upper right tooth since several weeks. On examination, tooth was found to be non-carious. However, halitosis was present. The diagnosis is, then the options given were chronic maxillary sinusitis, acute alveolar abscess, acute maxillary sinusitis, or nasal obstruction. So let us just go option by option and rule out to find the answer for this question. So first of all, let us come from this. So nasal obstruction. So nasal obstruction, as they have given a hint about dental problem, we can rule out this answer. Okay, And coming to the acute alveolar abscess. Acute alveolar abscess, the tooth is actually carious. Okay. So hence, this is a non-carious tooth. The acute alveolar abscess is also ruled out. And coming to whether it is chronic or acute maxillary sinusitis. So in the question they have given that the pain was lingering from several weeks. So it might be more than 12 weeks. So with that assumption, we can come to the answer that chronic maxillary sinusitis. Okay, so this is how you can answer this question. So if you like our video, do subscribe to our YouTube channel. You can also follow us on Instagram at DOCSHAALA for dental content and at DOCSHAALA medical for medical content. You can also follow us on Telegram. Thank you.